Do you think there's any big difference between the Korean plastic surgery and the foreign plastic surgery?
Different from the skeleton, etc. Usually the Western people got a huge bone and huge cartilage, but Eastern people does not. So it's different from person to person. I think the Korean people got very interested in the aesthetic surgery, delicate procedure, rejuvenation, I think.
So what types of facelift exist in Korea and what kind of people need to do it? Like there's an age, specifically age or something like that?
Yeah, it depends on the saggy tissue. If there's lots of saggy tissue in person, so we can elevate the skin as well as the mass. So differ from the procedure, how much amount of tissue we can elevate it. It differs from the range, etc. It's different from the simple to complicated procedure. So it depends on the condition of the patient and age, etc.
I see. What do you think do more this kind of procedure, like facelift, Koreans or foreigners?
There's lots of difference in between the Korean and the foreign person, so it's common.
What is the common side effects for this procedure?
Facelift,
Yes.
maybe the hematoma and numbness, asymmetry, scar.
So like when numbness go away, what do we have to take care
Usually
of?
as time goes by, the numbness will go away.
But what do we have to do after care process?
Care process. If we do the surgery very carefully, there is a very low complication rate. So if there is a complication, as I mentioned before, it's actually a minor complication. But make their numbness will be recovered as time goes by. And if there is a motor problem, you can do their exercise with the animation, etc. It will be improved.
Does the recovery, if there's anything related to the age, like if the person is older, does it take longer to recover from that? Or?
If even though the patient at an old age, the complication rate is not related to age.
So how long it takes for the patient to see a final result?
Most surgery, in most patient, the surgery final results you can see in 6 months after the surgery. Usually.
Can we do several procedures at once, like several surgeries?
Yeah, sure. Usually, the foreign people come to Korea. They got not enough time, so we do their several surgery at the same day, at the same time.
If you want to learn more about our procedures, check out answerplasticsurgery.com after watching this video.
So what is the main concern when people want to do rhinoplasty? Like there's a difference between Asian people and foreigners?
So usually, the Caucasian people want to reduce their nose and like the hump, etc. But Eastern people want to elevate her teeth or nose ridge. So it is a difference.
So, like, if the patient is worried about doing the silicone implant, like, there's any other way a doctor would recommend to them?
If the patient got the hump nose and the high nose bridge, there is no need to use the implant. But we must need to elevate the nose bridge. But patient don't want to use the silicone, then we can recommend dermal tissue. Your own dermal tissue. But if we need to elevate the nose bridge, but patient does not want to use that silicone, then we can use the dermal fat graft on the hip. The dermal fat graft can be also useful. And another option is the ADM. ADM means artificial dermal matrix. And another option is temporal fascia wrap.
Do you recommend this kind of procedure?
Recommend? Yeah, in this case, if patient does not want to use the silicone implant, yeah, we can use that.
If the patient has any breathing problems, does the surgery will help?
Yeah, in this clinic, usually when people are recovered from their breathing issue, we move the septum to the center if it is crooked or deviated. And after the surgery, usually the patient will be very pleased with the result.
If the patient doesn't want to do like a surgical procedure, there's anything else they can do to fix their nose?
If the patient got a hump and there is very low nose bridge in the globular area, we can inject the filler to make a more even nose bridge. But filler does not elevate the nose bridge, nose tip. So if there is a low nose bridge, then we can, in that case, we can use the filler instead of surgery.
I heard when a person do boob surgery and they put an implant, sometimes they have to change every 10 years. Does this, like the silicone in their nose, do they have to change as well, or they can stay forever?
You mean that you must change the silicone for 10 years, maybe?
Yeah.
I don't think so, but if the surgery is adequate and there's no problem, so there's no need to change the silicone in the nose.